I'm Yolanda Alvarez Casau, and I work at Energy as a research consultant.
I am Silvio Agne. I am professor of chemistry at the University of Torino.
So the role of Energy is the producer of Lutetium-177. Lutetium-177 is a medical radioisotope, and it works when it's bind to radioligand, which in this case for prostate cancer is PSMA. This combination of Lutetium-177 and PSMA is injected into the body, and it goes to the cancer cells of the prostate cancer, and it releases energy that destroys these cells, while the healthy cells are unharmed. So right now we are just meeting the demand nowadays, but it's foreseen that the demand will grow because there are new treatments being developed and accepted. Right now the process that we are developing is for about 50 patient doses, which is 10 times more than the previous process. We are also developing the recycling process for the starting material because it's a scarce element, and we rely on outside European Union suppliers. So with the recycling of this starting material, we foresee that the supply of lutetium will be also more reliable and stable. So we have two effects. One is that if there is a stop in the supply chains, then the patients will not be able to be treated, so they will have to wait for the treatment with the consequences that can have for their health. So second, if there is a shortage of the radioisotope, the cost of the treatment can increase, and then less people will be able to have access to the treatment. So for me, being part of ILLUMINATE is very exciting because we get to increase the production of lutetium, so more patients will be able to have access to their treatments and hopefully to enlarge their life expectancy of their quality of life.
My role in ILLUMINATE is to act as a coordinator of the activity of 4 groups of researchers, which have the role of finding new procedure in order to acquire information on cellular metabolism at imaging field currently used in the clinical practice. Well, one of the main tasks of our imaging center has been the design and testing of a new imaging agent able to enhance the sensitivity of the imaging techniques, in particular magnetic resonance imaging. We do hope that altogether this will help to get a better understanding of MRI. This will be, we think, important for patients, first of all, because our kind of application that could be easily transferred to the clinical setting, being based on agents that are currently already approved by the regulatory agencies. So we think that in the possibility to get more insight into the cellular metabolism as early hallmark of the cellular metabolism could be of paramount importance in the assessment of the ongoing therapeutic treatment. So we should aim to have an information about the efficacy of a given therapeutic treatment, and in particular the one that is here applied in the ILLUMINATE project, as a time as short as possible, and in order that eventual stratification of patient can be considered.